So we're valuing the wrong thing. We're valuing the savings. We're measuring the savings, the short-term savings, instead of the long-term benefit to the population and the healthcare system and the health of our country as a whole. That's the problem. What we need in a value-based system is to reward things that are going to get us to a more efficient, less expensive, healthier population. And instead, we're valuing it or we're measuring it by how much we saved in a year. That doesn't make any sense.
Yeah, I think the reason they do that is the insurance carriers say, why should I invest in this child?
Correct.
20 years.
100%.
And then they're healthy. And then they move on to another company and they don't get diabetes, they don't get obesity and things like that. And those
It's the wrong pocket.
That is a narrative that destroys our ability to negotiate. And Dr. McQueen was very clear with you on the podcast about that. That is not true. So when an insurance company says, oh, why should I, which they don't, but they say, why should I spend $1,000 on Johnny? And then he moves on and I don't get the savings when he gets sick 10 years down the road.
Yep.
Because Mr. Insurance Company, when Johnny's sick 10 years down the road, he might have gone from Anthem to United to Aetna back to Anthem. And you're going to get those savings. And if you're not talking that language, we're saying, oh, they only care about the quarter. They'll play along with you to give you less reimbursement because you just put the hook on yourself. Okay.
Yeah,
So,
the real reason is because their goal is to get the money now. They don't care about the money later. That's the issue.
And then we also need to talk about this because we talked about this before. The way you loop around that is by talking to the Fortune 500 and the biggest employers in your region about how they're on the hook for this money, no matter who's paying the claims. That the school system in Lincoln, Nebraska is on the hook for that child until he's 25 years of age, as long as the teacher's still working for the system. And you can pay now, you can pay later, but you're going to pay anyhow.
That's why the best model in my mind, if you're going to do employer-based insurance, is direct to employer, right? Because what I do is not a risk, right? It's not like getting your fire insurance, right? And your house might burn down. And so there's going to be a few catastrophic cases, but most people are just going to pay and support the people with the catastrophic cases. And then there'll be a little bit off the top for the business to make, right? What I do is pretty predictable with a few catastrophic cases. And what really makes the most sense from a preventative standpoint and from a pediatric standpoint is direct to employer for the outpatient piece of it, right? You pay me to do all the preventative care for your patients. You pay me to do all the chronic care management, chronic disease management. We'll provide behavioral health services. We'll provide asthma services. We'll write prescriptions. We'll do a good job. We'll do their vaccines. And then you can buy a catastrophic plan to cover everything else. That model makes so much more sense.
Hold that thought, because I love that. And you're so much closer to where I want us to be. But hold that thought, because I got a couple of questions in between. Okay. So your practice is phenomenally well run, creates incredible value for your patients and your staff, has a tremendous impact on your community. But only 10% of your payments come through value-based medicine.
Oh, 100%. Yeah, you're right. And that's only in the last 3-4 years. We are on the back end of that movement.
And in a big part of it, there is a ethical consideration about these payments. Okay. I don't think anybody could disagree that screening for depression at the 12-year-old visit is not necessary, but still doesn't get done. But we do get into trouble when we start talking about what they measure as far as vaccination rates. And I've been very vocal. I think if you don't want to vaccinate, don't bring your kid to me. I don't want the moral. I don't want to worry about it. Okay. But there's a flip side, which is, what if you really are an Orthodox Jew and you live in an Orthodox neighborhood in the Bronx, and 80% of that community doesn't vaccinate the kids until before they go to school? So you're just gonna send all those kids in the emergency room because you're gonna be I couldn't practice like that.